Now we're going to talk about identifying your assets and your resources. It's likely that your organization is already creating resources to assist you in safely prescribing opioids. So reach out to your leaders, your peers, your QI contacts, or anyone in administration to help you discover the resources that are available. We know that larger systems do have more developed resources. For instance, many of them have these internally already assets. So senior leadership or local champion, opioid stewardship or oversight committee, pain and or opioid case review committees, EHR optimizers or experts, quality improvement facilitators, clinical experts, pain specialists, anesthesiologists, addiction and behavioral health or mental health providers, patient educators, pharmacists, peers and colleagues, clinical staff, care team, and administrators or operational support. But even if you're in a small system or if you need more resources, there are a lot of external assets like local or hospital pharmacists, expert referral network. It's really important if you're in the outstate region and you don't have a large organization in your back door, take an assessment of your community, look around and see what you have. Pull in the healthcare professionals, call them up, find your pain specialists for referral, find anesthesiologists, find addiction medicine, mental health providers, find all your pain treatment providers too. Figure out where are your physical therapists? Do you have a pool therapy? Do you have acupuncturists? Do you have exercise programs? What do you have in your community? And especially, we've been talking lately to some groups that have a large quantity of patients who are on high opioids with a provider who's about to retire. And understanding approximately how many patients you have that have high opioids who might need some assistance during tapering or for substance use disorder treatment. Say, we have all these patients here. Do you have enough providers if we referred to you today? Or what do you need to do if we all work together to bring our community within safe dosing? What could we do together and where are your resources? Check with your EHR vendor. They often have suggestions for what you could do with your EHR that you might not be. Professional societies and trade organizations, the Prescription Drug Monitoring Program, state and federal agencies, regional collaboratives, and Project ECHO or virtual case reviews. If you're not a part of the Project ECHOs that go on in the state, they are extremely informative. And yes, they do generally cover addiction and tapering, but there's always information and something in that case that you can pick up that will help you understand how better to manage a patient that you have. And they're always looking for cases to review. So this is a great way to get free advice. Your biggest asset is your care team. Prescribers need to engage their team and work together to safely manage complex patients on opioids. And they can be very complex. Some of them are easy, but some of them are very complex. Team-based care also allows all the staff to work at their highest level and increases professional satisfaction. Everybody likes it when they can work at the top of their skill set. So that includes things like pharmacy, CMAs, nursing, advanced practice professionals, and all your support staff. Giving them a role in this patient management is very rewarding. Ask your team members for ideas about improving care, and I bet you will get a wealth of information. And then work with administration to clarify roles and assess the capacity of the team. Sometimes you have union staff, sometimes you have staff that have different levels of training. So you want them to work within their scope of practice, and you want to make sure that you're not overstepping with their role, what they were hired to do, without kind of talking it through. All right, so there's some tested strategies. Hold on here. There's some tested strategies to meet the needs of your population. So pharmacists can help manage a taper and educate patients. Clinical staff, nurses, or social workers can do care coordination and assessment. Advanced practice providers can co-manage visits for patients on quote. Rooming staff can perform screening and documentation. Community health workers can do safety visits, and behavioral health staff that are co-located in your clinic can be a part of the team. There's nothing better than walking down the hall and getting a hallway consult on that.